Hello, my name is Emily Morris. This is Joy Kidd, Mary DeVilliers, and Jessica Wooten. We are in the Nursing Theory Class 5120, and we're doing a concept analysis presentation on motivational interviewing.
Hi, I'm Joy Kidd, and what I will be beginning with is the background and significance. Motivational interviewing is one way of making changes in health promotion practice. The purpose of MI is to help people understand their lifestyle problems and make positive changes. MI was first used in the 1980s by Miller and Rolnick. The concept of motivational interviewing evolved from treating alcoholism. MI is defined as a directed, patient-centered counseling style. MI places different demands on nurses. Those who use motivational interviewing must continually incorporate this into their practice, or else they will fall back into their old ways of merely just giving advice. Next, we have the meaning and published works. For this section, there are 3 different studies that are addressed. In Study 1, which was in 2011, describes primary nurses' experience with motivational interviewing as a health promotion in daily practice. The study had a descriptive design and used a qualitative method. There were 20 nurses who actively used MI in their work. The results showed that the process is a demanding but useful method of health promotion. The study also states that awareness about the method can lead to increased use and development of motivational interviewing in a nursing practice. Study number 2. In 2012, this study discussed counselors' behaviors that mediated motivational interviewing and states it is not well understood when applied to health behavior promotion. They hypothesized that the relationship between counselor and client can influence the effect of MI and client behavior change. Purposeful sampling was used to identify individuals who, from a randomized worksite trial using MI intervention to promote firefighters' healthy diet and exercise program. Results showed that the counselor's spirit, empathy, direction, and MI consistent behavior counts significantly correlated with firefighters' change. The importance of teaching proper behavior techniques is determined to obtain lasting results in a client's change of behavior. In a third study in 2012, case managers were seeking to improve their patient outcomes using motivational interviewing. The study was performed in hospitals, patient-centered medical homes, physician practices, clinics, and other settings where case managers were in use. MI is effective for gathering, informing, information, uncovered health change needs, and obtaining good relationships with their clients. It also motivated positive change for clients and trust between the case manager and her patient. Next, we move to the purpose. A concept analysis is an exercise designed to make the researcher as familiar as possible with a concept. It is usually 1 or 2 words that convey meaning, understanding, or feelings between or among individuals within a group. Concept analysis helps distinguish between the attributes of a concept and its irrelevant parts. The main goal of a concept analysis of motivational interviewing are to engage clients, change talk strategies, and promote motivation to make positive change and improve healthcare behavioral patterns. Next, we move to definitions and defining attributes. The most recent definition of motivational interviewing from 2012 is a collaborative, person-centered form of guiding to elicit and strengthen motivation for change. MI is grounded with a focus on building rapport. A central concept of MI is the identification, examination, and resolution of ambivalence about the patient's changing behaviors. There are 4 must-haves for change. These are: motivation to change must stem from the patient. Goals promoting change must be identified. Patients' belief and ability to meet goals must be reinforced. And finally, readiness to change are the final results. There are 4 primary tools offered by using motivational interviewing. The first tool is expressing empathy, which refers to an effort to understand the client's view and convey that understanding. The second is developing discrepancy, which entails listening for strategies that can help the client to identify a particular behavior. The third tool is rolling with resistance and avoiding argumentation. This refers to the nurse's ability to diminish a resistant situation and proceed with a positive direction. The last tool involves supporting self-efficiency. This is the ability to support the patient's hopefulness that change is possible.
Hi, my name is Mary DeVilliers, and I'm going to be talking about the 5 cases. The first one is the model case. According to Walker and Avant, the example of motivational interviewing that gives the most precise representation of the concept is the model case. It sets the tone for all other cases by giving a pure exemplar, citing all defining attributes. Van Ness and Savatsky state that the model case of motivational interviewing should include patient-initiated motivation to change, identification of goals to promote change, reinforcement of the patient's belief in their ability to achieve a goal, and the resulting readiness to change. An example of a model case of motivational interviewing is: a patient with a history of smoking has just been hospitalized with a myocardial infarction. He verbalizes fear of the damage that many years of smoking has done to his body and states that he does not want to smoke again. His nurse provides him with a brochure referring him to resources available to help him stop smoking and makes an appointment for him with his primary care physician upon discharge to discuss his plan. She encourages him by telling him that although it may be difficult, he can stop smoking, and simply verbalizing the desire is a good starting point. The patient responds by agreeing with her and stating that earlier today he smoked his last cigarette, and as soon as he is released from the hospital, he will see his doctor for help. The next is the related case. According to Walker and Avant, a related case very nearly resembles the model case, but it may not contain all of the defining attributes, or they may differ slightly. It may also be identified by another name that differentiates it from the concept being analyzed. An example of a related concept is self-determination theory. This concept is different in that it identifies motivation as being intrinsic, based on need satisfaction, and something that another person cannot alter. In contrast, the purpose of motivational interviewing is to alter the patient's will by helping them visualize a desired change. The differences are very subtle, yet placing them side by side clarifies the concept being analyzed by pinpointing those differences. An example is: an obese patient desires to lose weight, stating it'll make her feel better about herself. The nurse encourages her to begin a weight loss regimen immediately. The patient states her mind is made up and she will begin a weight loss program today. The nurse expresses happiness for the patient who has made up her mind to do something to improve her health. In this example, the nurse does not alter the patient's will by helping her to identify goals and believe in her ability to achieve them, because the patient already has the intrinsic desire to change. Next, we have the borderline case. As described in Chen and Kramer, borderline cases give the words of the concept being analyzed different meaning. It uses metaphors as a play on words, altering their meaning, thus altering the concept. If motivations were actual objects or people, motivational interviewing would be the act of interviewing motivations. Picturing a television reporter holding a microphone, one can visualize him or her saying, "Mr. Motivation, when do you plan on quitting drinking, and what technique have you decided to use? Our sources say you were seen at the Alcoholics Anonymous meeting last week. Is that true?" Next, we have the contrary case. Walker and Avent describe the contrary case as an example of what the concept does not convey. It may not be the opposite, but it is something quite different, and the more concrete the concept is, the easier it is to recognize a contrary case. According to Chen and Kramer, the contrary case also helps to clarify the concept being analyzed by providing a clear picture of what the concept is not. A patient wonders if his hypertension would go away if he lost weight and quit smoking. His nurse tells him that these kinds of lifestyle changes are hard to commit to, and there is no guarantee that it will work for him. She tells him that since he has a stressful job and likes salty snacks, he will most likely have hypertension for the rest of his life. And finally, we have the invented case. Walker and Avent define an invented case as one that takes the concept and applies it to a completely foreign situation. It is very much like the model case in that it contains all of the critical attributes, but places them in an environment that is make-believe. An invented case is a humorous way of developing concept analysis. An example might be, the family dog tells the family cat that he is tired of being punished for chewing his master's slippers. The cat asks him if he is willing to make the changes necessary to break this habit. He verbalizes his desire to stop chewing slippers and asks the cat for advice about how to accomplish this. The cat helps him make a list of goals that he can work toward in breaking this habit. The cat encourages the dog by telling him that he has the innate ability to obey his master and that it is within his power to stop chewing slippers. The dog responds by saying he is ready to change his bad behavior.
Hi, I'm Jessica. Certain conditions must be present for the concept of MI to occur. These are the antecedents. Attributes, as discussed by Joy, are the defining characteristics of a concept. And consequences are the results of that concept. Antecedents include there must be a willing interviewee and interviewer. There must be an identified need and desire for change, and there must be collaboration between the two parties. Consequences of motivational interviewing include the identification of problems and the empowerment of the patients to improve their health care. As with the dog and the cat, for MI to occur, you must have a willing interviewer or an interviewee. It must be the dog's autonomous choice to collaborate with the cat, and there must be an existing maladaptive process and the ability to identify it or problem solve. As with the dog, the problem itself must also have some personal significance, thus providing the motivation for change. MI will then, in turn, help to explore the maladaptive process and empower the dog to make the desired change and promote its healthy behavior. Empirical indicators are proof that a concept exists. Motivational interviewing has many published works supporting its usefulness, including books and over 200 studies. Several instruments have also been developed to assist with motivational interviewing training and assess the interviewer's skills and also to test the reliability of MI. Studies have shown that motivational interviewing has a positive effect on the lifestyles of alcoholism, poor eating habits, physical inactivity, and other targeted lifestyle behaviors. Its use in practice has been well validated. The operational definition of motivational interviewing for this concept analysis is mutual collaboration between the nurse and the client for the purpose of creating change in the client's health behavior, resulting in a healthier lifestyle.
Hey, I'm Emily. In summary, motivational interviewing emphasizes the use of autonomous motivation described in the self-determination theory. There are two types: autonomous, which is self-motivated change, and controlled, which is an outside motivated change. The fundamental purpose of motivational interviewing is to help people understand their lifestyle problems and make positive changes in their everyday lives. With increased knowledge acquisition, poor lifestyle choices are reduced such that overall health is improved. In MI, there are 5 techniques that make communication easier and increase understanding. They are confirmation, open-ended questions, reflective listening, summarization, and initiated discussion about change. Overall, motivational interviewing is a form of patient empowerment. It's a cooperation between the nurse and the client. It influences positive lifestyles, reduces resistance to change, and increases the readiness to change.